Like and subscribe and click the bell icon to get new video updates.
Complacency over COVID is costing us by Brendan Crabb and Mike Toole, May 13, 2022, 11:00 am. Save login, register or subscribe to save articles for later. Share normal text size, larger text size, very large text size. 102 View all comments. 5 weeks into an election campaign, there has been nary a mention by either major party about the greatest public health crisis in our lifetimes. The COVID-19 pandemic is being presented to the public as something that happened in the past. And this messaging is not just at the federal level. Every state and territory is on board. But the reality is very different. The pandemic is still with us and is hurting us badly. On average, Australia is reporting an eye-watering 40,000 plus new cases every day. Australia now ranks second in the world for cases per million among countries with a population of more than 1 million. There is no sign of this slowing down. COVID-19 is still putting huge strains on our health system. Credit, Getty Images. High case numbers matter to our health and to the functioning of our society. Ambulance ramping, emergency department and healthcare stress, travel chaos, general staff shortages, school disruptions, and a slow return to work are just some examples that tell a polar opposite story to the prevailing live with COVID narrative. 350,000 people currently have COVID in Australia, all are at home, more than 3,000 are in hospital, and an incomprehensible 40 or so are dying each day. More than 5,000 people have lost their lives in the last 4.5 months, twice the number of flu deaths in the past 6 years. As the Bureau of Statistics revealed, COVID-19 was the second most common cause of death in January 2022. This is an extraordinary toll. Not to mention the looming threat of long COVID, which according to overseas data may affect up to 10% of those infected. This syndrome, which is still poorly understood, can affect the heart, brain, liver and other organs and could cause high levels of absenteeism and place even further pressure on the healthcare system. Uncertainty in this alone is sufficient to adopt the precautionary principle. It's no accident that we have such high case numbers. It is more or less universal policy to release the brakes to such a degree that a large proportion of the Australian population has been infected in just a matter of months. Somehow, we have ourselves believing that almost unfettered COVID-19 spread is okay, that it's a price worth paying to have our freedom, our businesses, social life, schools and society back to normal. The widely expressed sentiment, from the top down, is we have a well-vaccinated population that has reduced COVID to nothing more than the flu, so let's just get on with it. But this is misleading, and it's an attitude that is costing us dearly. So, what will happen as we enter winter when there will be a lot more indoor gatherings? Without mask mandates and inadequate attention to indoor ventilation, the highly infectious Omicron BA.2 subvariant, and its evolved relatives BA.2.12.1, BA.4 and BA.5 that are now here in Australia, will inevitably spread widely, leading to more cases, hospitalizations, and deaths. In addition, there are already signs of a significant influenza season. What is of most concern is the emergence of a new variant of concern, a new curveball like Delta and Omicron were when they arrived, coinciding with winter. On average, a new variant has emerged every 6 months, so we are already overdue for a new one. Is there a better way? The short answer is a resounding yes. The most important thing is to change our collective attitude to one that says transmission matters, and then to base a response on critical interventions that we know are not onerous: vaccination, a clean air strategy, high-quality masks indoors and testing. Testing is crucial, both to surveillance, as we are flying blind otherwise, and to individuals such as those who have COVID simply must know, so they can protect others by isolating. As effective as vaccines are, and they are rightly the backbone of our response, the mantra that we are even close to sufficiently vaccinated is plain wrong. While 2-dose coverage is high, we know that 2 doses is not sufficient to protect against Omicron. Only 70% of eligible Australians have had a 3rd dose, and many now need their fourth. What is even more worrying is that only 37% of children aged 5 to 11 years have had 2 doses of vaccine. And of course, children under 5 remain unvaccinated as there is not yet a licensed vaccine for this group. We need to do much better. The irony of all this is that high transmission is not a price we are paying for our freedom. It is robbing us of it. As one of the countries with the worst transmission rates of COVID-19 in the world, we urgently need a change of mindset to one where reducing the